The self-care can be, of course, working out. It could just be as little as taking walks every day, you know, or
Right.
5 times a week. And just when you're eating, not eating, McDonald's is not your friend. I don't know if people know.
How
McDonald's is
about we just say fast food is not their friend?
Right.
fast food is not your friend. Leave it alone.
Absolutely.
And what's crazy is I tried a few different therapists when I came back, mainly because I really wanted to see what I kind of, not that I wanted to see what my competition was doing, but I wanted to see how everyone's method was, right?
Mm-hmm.
So I went to like maybe 4 or 5 different therapists, and even one lady told me, she was just like, yeah, you can eat whatever you want. You can eat ice cream, you can eat anything, just keep your faja on and you'll be fine. This is the advice. This is the advice that the professional gave me
As a client, and you are a professional.
as the client.
Mm-hmm.
To told me to just keep my faja on very, very tight, and I can eat whatever I want, and my stomach will still be flat. And that was not the case. I think a lot of women too, if they're not, if they haven't practiced prior to the surgery, even me, I wasn't in the best of shape that I could have been prior to my surgery. So coming back and trying to like get my mind in that process was just, it was hard, So I think there's this like there's this common thing that most women go through, that they, after surgery, they're nice and slim, and then they gain this weight and then they come back down. I think I don't know if you guys notice that sometimes, like if you're not in the mind frame prior, you're going to go through this fluctuation after.
Mm-hmm.
And then once you get it in your mind and you start working out, then you'll come back to your size.
Uh-huh. Absolutely. Absolutely. So the next question I want to ask you professionals is this. Would you recommend any type of pre-massage therapy care prior to the surgery, and if so, why? Starting with Wendy.
I do suggest it because it helps loosen the fat up so the surgeon can take out more fat better. So it's not so lumpy. But a lot of people just think you're just, like they say, you're just trying to take our money. Like, no, this would really benefit your results. I don't know why they don't, but that's because we understand anatomy. So to us, we just see the anatomy and the client sees the money.
Right. Dior, do you agree?
Absolutely. And most people don't do pre-op massages, and it comes down to a money thing, point blank, period.
Mm-hmm.
Yeah.
Gina?
Yes, so I definitely recommend pre-op treatments. And like Wendy was saying, it definitely helps to just loosen up the fat to make it easier for the cannula to suck it up. So if it's easier for the cannula to suck it up, one, it makes your surgery shorter. So two, they can suck out more. Well, three, right? Three, they can suck out more. So four, you're going to get better results. So it does, like, for me, it's just like common sense. But I guess, like Wendy said, because we know the anatomy, and the way Dior said, like, it's something that it comes down a lot of times to money. But if they knew that it would help their final result, I don't know, maybe more people would do it. I mean, we talk about it, but I feel like just a lot of people who aren't informed are talking about it more than we are, because we're so busy with clients and working and teaching and doing all this. We don't have the time to really sit there and speak to every single person that's having surgery, but it's so important. The pre-op procedures are so important. They're not as important as the post-op, but they're right up there. They're number 3. So
Right. I agree. 100%. Next, ladies, my next question is this. Have you seen a difference? I know I have, between ladies who get the surgeries in the US compared to the dolls that get, y'all know where I'm going?
yes.
Compared to the dolls that get the surgery out of country. So
Yes.
I want y'all to talk about the differences that you see in the body, starting with Gina.
Okay. There's a huge difference. especially in terms of the sculpting. I feel that we, in the U.S., the sculpting, our doctors are not as focused on the sculpting, the tiny waist, big booty, or you know.
You can go ahead and say it. It's free.
Okay.
Feel free to say what it is.
Big asses.
Yeah, so they not out here with these vixen bodies. They're not out here doing these vixen bodies. So I think that is the main thing that I see. When you go out of the country, you're gonna come back with a big ass, like tiny waist. Your ass is gonna be huge. Your breasts are gonna be sitting up under your chin. But the one thing I do have to say about the breast, though, sometimes the what I've noticed in the DR, I've noticed better breasts in, let's say Colombia than in DR and Mexico, because the breasts sometimes are like, I'm gonna have one nipple to the east and one nipple to the south, right? And it looks crazy. The U.S. the breasts are usually on point, I guess, because U.S. practices more breast work. The breast work is usually on point in the U.S. But in terms of sculpting, where you're going to get that tiny itty bitty waist, I generally see better results outside of the country, particularly in I want to say and I've seen great work in like Colombia, in DR. DR is like, they go to the extreme if they can. They're gonna do it. Mexico, but even the Bahamas, I've seen some amazing work. But it's just that I see that it's more extreme when it's out of the country than here in the U.S.
Okay.
Yeah, I agree.
Dior?
Yeah, I'm seconding what Gina said, and I think it's a cultural thing as well.
Yeah.
And these islands, and these what do you call in the islands, whether it's a Spanish island or a Black island or whatever, we're just more curvaceous, and that is more appealing to the eye. So when that's what you know of what a description of what the woman body is, that's what you gear towards.
Right.
So we already know that there's a big chance if you go to a doctor in the U.S., unless he is from the islands or he was trained from someone, you may not get. I mean, Miami's stepping up.
Give you that one.
You're absolutely right about that. Miami is stepping up. There's a few doctors in Miami that are like delivering. Chang has been delivering lately. Dowback is like killing. I don't know what happened there, but it's like the waist is just like, whoop. I was like, oh, okay.
Mm-hmm. Wendy?
Yeah. Yes, it's a big difference, but what I really learned is that it's about the woman and her preference.
Okay.
Because they do so much research, and they say, oh, I want to look like this girl, or I want to look like this girl, or so that's what I learned. That's what they look after. It's not to what my clients say. They don't really look at the doctor. They just look at the shape they want, and then they say, oh, well, out of 10 girls, 8 girls with the same doctor whose shape I like, so I'm going with that doctor.
Okay.
They're not really doing too much research now about the doctors, how many bodies, or anything pertaining to that. They just like, oh, she's shaped like this. I want to be shaped like her. I want to be shaped like this person, so I'm going to their doctor.
Right.
That doesn't necessarily mean that doctor.
I find that it is a little bit harder to do research per se for doctors overseas, because even when I was trying to find out like what doctors were board certified, and I was trying to search it online, it wasn't as easy for me to find. And like literally, I had a Spanish client that I was asking her about it, and she was able to pull it very quickly on her phone because her Google was catered to it was in Spanish. So because like for example in DR their medical page is all in Spanish, it's not going to pop up for me because my setting is for English. So like really, what is the research? What exactly are you looking for when you're doing research?
I think that's an amazing point. When people are going in for surgery, a lot of times they're like, "Oh yeah, I did my research," and their research literally is looking at other people who've had surgery with that person, like Wendy said. But there's so much more. There are, as Dior said, there's so many sites where you can actually look and find out if your doctor is board certified, whether they're here or they're in Thailand. You can find out if your doctor is board certified. You can find out if they have other things, if they've had lawsuits, because these things are just like here, that those are open records. You just have to know where and how to find them. And the issue that I've been seeing is that people don't know how to find them, so they're just going with what they see in these groups.
Especially with these secret groups.
Yes.
There's a lot of secret groups.
There's a lot of groups. I try to join some of them.
It's a cult.
But it's like, it's not enough. It's not enough. There's not enough of us, and there's not enough time in the day to try to educate every single person on all these. There are millions of girls on these groups. Like, it's not enough of us to like really educate them the way we need to, so they are aware and they know how to figure things out and search and research for themselves.
Okay. Next question, ladies, is this. When in the post-op care should the dolls be put on machines, starting with Wendy?
I don't do machines. All my work is manual. Only time I do machines is if somebody like 6 months, they just didn't follow through. They didn't do the massages. They just, body is messed up. But until 6 months, I do all manual work.
I'm going to say this to everybody. Everybody that's watching this or listening to this live stream, Wendy has amazing results, as with all these ladies. But Wendy has perfected it in Detroit. Yes, she has. Dior, you're next.
My water.
So I was trained by Miss Carolyn here.
Yes, she was.
And then I've gotten training by Gina as well. Like, there's really never a limit of learning in which receive.
Right.
I was trained on manual. I'm not like super big with machines, but I will add in ultrasound. And I am somewhat guilty because you kind of have to be in the industry and be up to date with what everyone's doing, as long as it's not hurting the client. So even though, like, I know ultrasound can help with the bruising and the pain, even when I was receiving ultrasound, like, I still was in pain. So it's just like, really, how much level, like, what is it really changing? Your body's just going to heal at the rate that it's going to heal. The ultrasound does help. But cavitation, absolutely. I don't understand when people use it. I guess they have their reasonings. Even a lady I went to, she used cavitation on me, and I was just like, oh, I thought you know, and not everyone I told that I was a post-op specialist, Like, oh, I heard that you're not supposed to use cavitation. Like, no, absolutely. You want to break up the this and the that or whatever. She had her reasoning, and she was adamant about her reasoning. I really don't feel like, I'm more of a hands-on manual type of girl up until probably like 2.5, 3 months. It just depends. It depends.
Okay.
Gina?
All right. So with me, it's different because okay, you guys started off massage therapy and I am straight up aesthetics, right? So I do a lot of manual in the beginning. So I start off with tons of manual. It's predominantly manual in the beginning, and then I also do I do pressotherapy, which is a machine where they lay in. It's mechanical lymphatic drainage. So that is not necessarily like machine, like hands machine, but I definitely go into that. I do ultrasound because of the bruising and the pain. It works pretty effectively for me. It depends. So the thing is, when you're doing the ultrasound, you have to know which ultrasound you're using. There's the 1 megahertz and the 3 megahertz. People are going out, they're buying the 3 megahertz. They don't know that you're supposed to use the 1. So they don't, it's like people are not really informed. Like,
they don't even know what you're talking about, really.
Yeah, they don't know what they're really supposed to be using. And so that, I think that plays a big part, because if somebody is using the wrong frequency on you, then they can do more harm than good. When Dior mentioned cavitation, I don't do cavitation until after 3 months minimum, and it depends on how you're healing. Because if you are not, huh?
No, I'm sorry. Go ahead.
Okay, and it's like it depends on how you're healing. If your body is not ready for the cavitation, you're gonna have to wait the 6 months, and I'm sorry, because you just can't do it too early. Because I've seen really I've seen bad things happen to people. I have people come here who have been burned with the cavitation, and they come here and they're like, oh, I went somewhere else, and like I got burned with the cavitation. I'm like, you're 3 weeks. Why is somebody using cavitation on you? I don't know. Like, I don't understand. And being like, for me, my training never ends, right? So I take post-op classes everywhere, right? So I'm like, I've taken them here in the US, I've taken in Mexico, I've taken in Colombia, and I'm not done. I want to learn everything from everybody, from everyone. I want to know every single if there's a little piece of information that I don't know, I want to get it, right? So I don't understand why people are doing things that they don't know. So machines I don't use right away. I definitely go into manual first, and then as they progress and they heal, then I go into machines. Even radio frequency, which people think that it's just okay to do right off the bat, you can't do. You literally can like boil the fluid under somebody's skin. It's, I don't know, like it kind of bugs me, but people out here doing it.
That's true. Next question, ladies, is at what point in the doll's post-op care, because post-op is going to be from the time she gets that body off of the surgeon's table up to a year. So at what point do you start using other techniques, other modalities in her post-op to include the primary? Well, let's go with the second phase of post-op into maintenance.
Okay.
Gina, start with you.
Okay, so if we're going into, okay, so my lymphatic massages, I can literally sometimes do the lymphatic right up until like 6 months, because it just depends on if the person keeps on swelling, if they still need it, if they're still just, for some reason, like the flow is different, but the frequency will be different. I don't know if that makes sense. So in the first week, if they come in right out of surgery, their first week, I usually see them, I see them maybe like 4 or 5 times that first week. And then when we go into the second week, it's more like 3 times, and then we'll do 3 times for a couple weeks, and then 2. And then as we progress, we'll go to once a week. So that'll change. But once I start getting into different modalities, generally, depending on the person's healing, anywhere from 2 months on. But again, it depends, because I do customize everything. If somebody comes to me and I see like right off the bat, like they're going to have fibrosis, I'm going to start with my fibrosis treatment. So I'm not gonna go, like, it's not gonna just be the regular lymphatic massages.
Right.
You know.
Wendy?
I usually start at 6 months, but it does depend on if they come with a situation. So if they just haven't been eating right, they be eating fast food, they haven't been wearing their garment properly, and it's really hard spot, I might use a little bit of cavitation just to melt it, warm it up more so down. Otherwise, I really just do a lot of manual work. And when I do offer them that maintenance, it's just about them, because so many people will do maintenance and then just stop, and then come back 3 months later like, oh, I got to go to a wedding. Like, Okay, what you want?
I call it MIA. They go
No,
MIA on us. They disappear.
So it's like that consistent client. Of course, we can make the consistent client stay contoured and sculpted better than a client that's going to skip 30 to 60 days with you and then jump therapist, or might go over here and then this lady do this and then this person do that and then they come back to you and then you cleaning up yet again behind them. So now you have to modify your treatment to customize the client.
Yes. Dior, she's answering questions.
Oh yeah. What was the question again? I'm sorry. Just so I can remember.
Okay. The question is, at what point in post-op do you start using other techniques or other modalities on your dolls?
So like pretty much we are all similar in our processes. It pretty much is based on the client, but for me, I usually don't really go into post-op. I don't go into like contouring until about 3 months, and that's just depending on where they are with swelling. Because even when I came back, I was still swollen for months, 5 months. I still was. It hurt up in this area, so I still had swelling. Like I thought I had the #1 swelling ever in plastic surgery history, the way that I was still swollen, so it just really depends on the person. But it's really it's this industry, because contouring it's so close to post-op. A lot of people are now becoming the post-op specialist along with contouring, and it just makes our jobs harder because there is money in the industry. There is, you can't just be taught it. It's really hard. And clients just don't have the money sometimes to keep up with the care.
Right.
And there are just clients that just do not listen. The clients who come off that table and lipo and they want to talk about, I'll see you in 3 days. I'm like, oh, you need to come tomorrow. you need to monitor what's going on. Wait, what? You want to come 3 days from now? And you got lipo only? Lipo is the most sensitive
aggressive
work. It's the most lipo has the most difficult recovery. Tummy tucks, your recovery, it's only one incision.
It's muted.
A little bit.
A little bit. We can hear you a little tiny bit.
Maybe the microphone.
Nope, can't hear you.
It just went, you were talking and then it went out.
Unmute your mic. There you go. Can you hear us now? But you gotta unmute your mic.
She did.
There's something going. It shows that her mic is muted.
I don't know what happened.
I don't know what happened either.
You might have to go out and come back in.
Gina, can you hear us?
She can hear us. She can hear us.
You want to log out and then come back in? Okay.
It's really hard in this industry, especially the ones who have invested, who are licensed professionals, because you could go to, not to be, no offense, no shade, but you can go to someone's auntie that does it in the house, in the basement, and they're great. They're great. I'm not gonna take away from that because they're great. They just do what they do. But people they don't want to keep up. Their life happens. The money, it comes. I have been blessed to have clients that know the importance, and they keep going, and they actually enjoy the service. People just want to come for the massage. Even I went for a massage last week, and I hadn't gone in a few, a month or so, and I felt so much better. I felt that I still had scar tissue that was in the wrong place.
Okay.
So it's important. It really is important to after that 3 month, 6 month mark, to just continue, whether it's just once a month or whatever. absolutely need to continue, and your diet, everything. It's just, this is your new life.
Yes, it is, because it is a lifestyle change. And that's something I don't think that the dolls understand, that it is a lifestyle change. If you have money to get the surgery, you have money to get the procedures, you need to have money for the post-op care, because the post-op care is going to be just as important and just as costly as the procedure. Would y'all agree? Hi, Gina, you're back. We still can't hear you. We still can't hear you.
Hold on.
We can hear you a little bit.
It's not the same.
Nah. Dior, unmute your mic. Unmute your mic, Dior. There you go.
I was saying, Gina, make sure that your volumes maybe on the speaker or something is up, because you were talking and it just went like lower and then it went away.
Can she hear us? Okay.
Really clearly.
There you go.
Oh, you guys can hear me now?
Yes.
Okay.
Yes.
I don't know what happened. But okay, now you guys can hear me okay.
Yes.
What was the question? I don't remember.
The question was, at what point in post-op care are you going to be using any type of different techniques or modalities?
Oh, I think I answered that one.
Yeah, we answered that. I think we all did that.
Hold on for 1 minute. Let me correct somebody. Just hold on. They typed something that's totally wrong. Okay.
What was the question?
Okay, let me say this. The ladies that you see on this live stream are professionals. They are not dolls. These are ladies that deliver post-op care and body contouring. They're not dolls. Only one of them is a doll, but she's also a professional. These are licensed estheticians and licensed aesthetics. Do you have any additional questions? No? We can move on. I just had to clear that up, okay? Had to clear that up.
Technically,
$2. Okay. $2, but still professionals. Because we have professionals on here with $2. That's good. Okay. Now,
Gina, you went out again.
Gina, you went out again. Can you hear us? Your
went
voice went out again. It has to be the mic on her computer, maybe.
If you're on the computer, just come back on it through the phone.
Okay, ladies, what I'm going to ask now from each of you is, what advice would you give to a potential doll that is looking to get surgery and post-op care? What advice would you give her? Okay. Wendy, what advice would you give her?
They're going to do what they want to do.
They are, Wendy. But at least
I want them to drink their water. I want them to drink, eat their pineapples. Those pineapples are really important because it really does help with the inflammation. If you can get you some fresh herbs, you really want to get some fresh herbal tea. Watch your diet. You know, one thing they really say, though, is the enzymes in your brain. So if you cause that anxiety, you're going to make yourself have that anxiety. Like, oh, why did I get surgery? I'm stupid. I see a lot of girls when they first come in that first couple of weeks, they beat themselves up for getting surgery. So just have a support system, too, because that support system is really important at night when you might be going through whatever you go through. I've seen a couple of girls even get addicted to the pain pills. So just do things in moderation, too.
Mm-hmm. Dior?
That was great advice.
It was.
Yeah, pain pills, be very careful with them. I'm not saying not to use them, but like she said, in moderation. Pineapple. I think that the best is to do things more naturally, like, you know, eating the fruits, fresh fruits, the juices. Even here, I sell the calendula tea, which is a flower that is perfect for inflammation, turmeric. Just do your research and look at all these holistic ways, and listen to your post-op care specialist. Like, that is going to be your best friend for the next possible 3 months, 6 months, and if you are on point, probably for the rest of your life. Just take the advice and do what you need to do so that you can have a successful recovery.
Gina?
So yeah, so I agree with a lot of what the, of what Dior said and Wendy said. So I generally tell people when they come in, I give them a list of things that they should eat. So I always put pineapple on the list. I say turmeric. I actually make a cold brew tea here that I give them, and now they're going to have the option to purchase because it actually helps with the inflammation. So I always tell them that. I give them the advice about the food and nutrition and, you know, eating the fast food. I do tell them to eat high in protein and make sure that if they got a fat transferred so they can retain the fat, they're high in protein. So it's not just like you're eating anything. You have to make sure that whatever it is good fats and good protein so you can keep the good parts and not gain the undesirable parts. So I would give them advice of to what to eat, nutrition. I would also tell them that, yeah, listen to your professionals. We are here for a reason. We paid these thousands and thousands and thousands and thousands of dollars for a reason to get all this education so we can help you. So that's what we're here for. Ask us. We will answer you, and we're here to help. So just listen to it so you're not wasting your money on things that you don't need to.
Agreed. Ladies, what I want y'all to do, we're about to wrap it up. I want to say thank you, but before you ladies
you know what else I wanted to say before you wrap it up? Your cream really does work.
Thank you. Yay! Thank you.
I was just, for post-op, you usually make your own, more so oil or cream, whatever you prefer. But when I did order it, my client even said it like, oh my goodness, this helps so much. It made her feel good. So the cream that she sells, her secret recipe, it is so good.
Thank you, Wendy. Thank you. What I want y'all ladies to do now is I want you to tell the people, tell the audience, they already know your name. I want you to give your Instagram, Facebook, all of your social media contact and your phone number so they can call you when they need to make an appointment and they are near in your city, state. Starting with Dior.
Oh, I was gonna write mine down and put a little paper up. You call me first.
Here I go.
So, my name on Instagram is Body Bar NJ. You can find me on Facebook, Body Bar by Dior. My telephone number is 551-233-8503. I do answer my DMs. I am not so popular that I can't reach the DMs. I will answer DMs. You can email me, bodybarnj@gmail.com. If you have any questions, I am here to help you. Even on my dog, I will give you some information. But you know, I will help you somewhat. But it's important to make sure that you have a connection with the therapist. Just don't be going and giving your money to anybody. Make sure you have a connection because that changes the whole thing. Just like how Wendy said, like when you come back, you want to have a support system. Like, you know, if you have anxiety, that's going to make you take longer to heal. So you want to make sure you have a good therapist. And at Body Bar, we focus on creating relationships with all of our clients. So if that's what you're looking for and you're in New Jersey, make sure you hit us up.
Wendy?
All right. Well, we know I'm here in Detroit, Michigan, but with my post-op, really, I have them book online. They can follow me on Instagram at queenofbodysculpting.com. That's my Facebook, Instagram, and Twitter. but I also do answer my DMs, but I'm really not big on the phone calls because what I find out is they pay the surgeon $5,000 and then they want to talk to you for like 2 hours and don't even want to pay you.
You're right. You're right.
Don't do that.
You get a little bit of information.
If you want an appointment, you'll just go book an appointment because my work speaks for itself. But if you are my client, you can call me, yes. But you know, some people literally, I have, they'll send you a whole book like, oh, can I do this? Can I do that? You just had surgery, but you didn't ask your doctor that. So that's why I start winging myself off answering so many calls. If it's somebody that just got off the table, then yes, please call me directly. But if it's someone that's just inquiring or they're, it's just like, I try not to go through those calls anymore.
That brings me to this point before we go to Gina.
Mm-hmm.
Do y'all charge for consultations?
Yes.
Okay. Dior?
I don't charge for consultations as of now because I just believe that a lot of my clients have booked with me because I've taken a little bit of time to just bring their anxiety down or reassure them that I am skilled. So I don't charge for consultations as of yet.
Okay.
Oh, but you will.
I mean, I might. I'm not gonna say I won't ever. I might.
Gina?
So I want to jump in there because I charge for consultations because it just started to get, like Wendy said, it started to get out of hand. People wanted to call me and talk to me for an hour and 45 minutes. They want to tell me their whole life story, well, their weight loss story, their mama, their brother, their sister, their uncle. I don't want to, I'm here to help you if you have an issue, but I am not your psychotherapist. So I started to charge for consultations because of that. Now, the consultations are $25. However, I do take that away from the package cost if you purchase a package. So it's kind of like it is free if you book me, but I don't think it's a lot of time sometimes when I'm sitting there and talking to somebody and helping them. And they take all that information and go to someone else who didn't have that information.
Right. Tell the audience how to reach you, Gina.
So I can be reached, of course, over the phone. It's 929-355-2877. However, it's much, much easier to make your appointment online. You can either book right through Instagram. My handle is beautyculture101. You can literally just follow at beautyculture101. And then on there, you can just click the link in my bio. There are services listed right there, and you can just click them. Or you can go directly to the website, which is www.beautyculture101. Everything is Beauty Culture 101 on all social media platforms. So follow me on Facebook, follow me on Insta.
Dior, would you want to say something?
I just wanted to, if you can just briefly go over the cost of what these services are and why we charge that, because we brushed over it earlier, why there's such a difference in the industry of prices and why prices are set why they are, because I think it's important for people to know why the prices are set certain and why they're different.
Yes, you can go first.
Well, let Gina go first.
Hey, how much do you charge for your services?
So you want me to?
I want Gina to go first, and then I want Wendy to go, and then I'll go.
Okay.
God,
So I think
I'm done.
I think the pricing is always based on location and of course how saturated your market is. So because you also have to be competitive. I consider myself like a pricing specialist. I really go into deep research before I start pricing anything. I have to make sure that, of course, it's a benefit for myself as well as the client, and I have to make sure that I'm competitive to the other people in my region. So that being said, I actually have new pricing coming out, as I have a new menu coming out. So my post-op cost it'll be $99 for the post-op treatment, and Usually people are here for about an hour, depending on if it's their first treatment or not. So generally I take a little bit more time if there's their very first treatment, but my rates are competitive.
Okay. Dior?
Yeah, so my rates start at $89. Well, to book, your deposit is $80, and I take a deposit because that shows me your commitment, and that allows me to commit to you as well. Yes, I am probably one of the more pricier people in my area, but you have to price what you feel like you are worth. I spend a lot of time on school. I'm still learning. I'm spending a lot of money every year to perfect my craft. Traveling, just going. So I feel like my knowledge and what I'm giving you, my environment, everything that I give you, that I'm not charging this and that. I'm not nickel and diming you. I'm giving you what I feel is fair for the labor that I'm giving you, because I'm standing on my feet for an hour. I am bending over your body for an hour, if not more. I am putting on your
Dior, I really don't think that we need to justify our costing. I really feel that we are like we're professionals. Like I'm one of the top people in my craft. I am not gonna justify like how much I charge. I'm fair. We're all fair.
Yeah, you're right.
We definitely make sure that we have results. So if you come in, you're gonna get the results. You're gonna get the knowledge. You're going to know how to take care of yourself when you are away from me, to ensure that you are constantly progressing and you are constantly getting better and looking better. So I don't think that it's what I do believe is that people should set aside a certain amount of money. I think people should set aside anywhere from $1,500 to $2,000 on their post-op care. Like if you're not ready to set aside $1,500 to $2,000 on your post-op care, then you should not have surgery, because the post-op care is just as important as your surgery. Because when you leave that doctor, they're not going to have time to nitpick and every single thing that's happening to you. When you come to the post-op care, you have an issue, you have a little lump, you have this, you have that, there's a wound, everything. I am the professional that is taking care of that for you. So I'm not going to justify the cost. I give you everything, 101%, and that's it.
I would have to agree with Gina. And I said this early on, if you have money to get the surgery and you're spending anywhere from $3,500 to $10,000 for your procedures, you need to have money for the post-op care, because the post-op care is just as important as that procedure that you had done. Your procedure may take 45 minutes to an hour, but your post-op care is going to take up to a year for your tissues to be fully recovered. So therefore, yes, I do agree with Gina that if you do have that procedure done, you need to have the money, ladies, have the money for the post-op, because the post-op is just as important. And the baseline is what Gina said, $1,500 up to $3,000, $1,500 up to $2,500, because you're going to be with that professional up to a year if you don't go MIA.
Yeah. And the people who have the best results are the people who stick with it. Those are the people, they're like, oh my gosh, she looks so good. How come I don't look like that? Well, because you skip appointments, you don't come in, you stop coming in. I am not a telepath, and I cannot massage you from your home, while I'm in here. So it's just, you need to be consistent, and I will always be consistent with the care that I give you, but you need to show up, and then we can both show out.
Yes, absolutely. Ladies, I want to say thank you. You will be receiving a copy of this live stream, and after I do the video editing to it, you will be getting a copy, and then you can share it on your social media as well. Thank you, ladies. Thank you very much, and I'll be talking to y'all later, probably later on tonight about this. Thank you.
I'm
okay. Thanks to you. Thanks, Gina. Bye-bye.
Bye-bye.